Hello, good morning everybody. I, Dr. Nilesh Balkawade, Clinical Head, Oasis Fertility Pune, welcome you to today's FB Live session. My mother, my friend so dear, throughout my life, you are the sunshine to light my day. With these feelings, I salute all moms and would-be moms in my today's FB Live session. We'll be talking about basics of IVF or in vitro fertilization today, or commonly called as test tube baby. We'll be talking about what is IVF, who needs IVF, is only IVF sufficient, when is IVF done in infertility treatment, how is IVF done, the success rate of IVF, the costs associated with it, methods to improve success. And in short, we'll be also talking about complicated cases like IVF failure, patients who have had IVF failure, recurrent implantation failure, recurrent pregnancy losses or multiple abortions, endometriosis, male subfertility with raised DFI, and so on. So to start with, we'll be talking about what is IVF. IVF or in vitro fertilization is fertilization which takes place outside the body. So what takes place inside the body is called as in vivo, and whenever we are calling it as in vitro fertilization, it is the fertilization of egg and the sperm outside the body of a female, and routinely we call this as IVF. And what is ICSI? So IVF, the terminology ICSI is also routinely used along with IVF. So ICSI is intracytoplasmic sperm injection. It is an advanced form of IVF where we inject a single best sperm into a good quality egg to achieve pregnancy. So routinely in IVF, we put the sperms around the oocyte, and one of the best sperms itself goes into the egg and fertilizes the egg. But in ICSI, we are doing that job as fertility specialists for the to help the sperm to go inside. So in certain conditions, we have to go for IVF. In certain conditions, we have no other options but to go for advanced technique called as ICSI or ICSI. We'll be shortly talking about who needs IVF. So there are causes for infertility, as we all know. That causes can be either causes in the male partner, causes in the female partner, or causes in the both. So for male factors, if we consider those patients who have severe oligoasthenoteratosphermia, those are the candidates who need to go for IVF directly. So what is oligospermia, what is astheno, and what is teratospermia? We'll just see in short. So whenever the count is less than 5 million, we call it as severe oligospermia. Astheno is associated with the motility of the sperm. So whenever the motility is less than 30%, then the patient might need IVF or ICSI. Whenever the morphology is at problem, like the more and more sperms are showing abnormal forms like globosospermia, round heads, micro heads. All these problems in the sperms can be dealt with effectively in the technique called as IVF or ICSI, where we do the sperm selection as the nature cannot do it on itself. So these are the factors where male factor can be a indication for IVF. Other male factors, like if there is obstructive azoospermia, where we don't have the sperms in the semen sample. The semen sample shows the count as 0 on two samples. This is called as azoospermia after proper centrifugation. In these patients, the testicular production of the sperms is normal. However, the outflow tract, which is guiding the sperms outside the body, is at fault. And whenever there is obstructive azoospermia, nature cannot give a natural pregnancy in this case, and also IUI is not helpful because the required amount of sperms cannot be obtained. However, in such patients, surgery can help to reduce the obstruction in some cases. However, the results are not so good. So the best option would be a testicular reduction retrieval of sperms, which we call as testicular sperm aspiration. And these patients usually have a very good number of sperms within the testis, and when the sperms are removed outside, we can utilize these sperms successively for IVF or ICSI. So this is one case. Another set of patients is non-obstructive azoospermia who don't have any obstruction, but the testicular production is at fault. In such patients, TISA or testicular sperm aspiration also may not help at times. So we have certain options called as micro TISA, where all this procedure is done under high power microscope, and such facilities are available at very advanced fertility centers. One of these centers is ours at Oasis Fertility, where we are doing micro TISA for such patients. So these are the male factors where we can do IVF. Now we'll be discussing about female factors. So all those females who are having tubal obstruction, and if this tubal obstruction is bilateral, both the tubic inflammatory disease which affects the well, and tuberculosis, cysts, blood filled cysts can be there, which is called as hematosulfings. So all these conditions of the tube, where the tube is anatomically abnormal, this can be a cause for infertility, and we can very well achieve good results with IVF. And to tell one good historical part of this, that one IVF was introduced way back in 1978 by Dr. Steptoe and Dr. Edwards in United Kingdom, and shortly within 3 months of that, Indian scientists also from West Bengal also introduced IVF, but his research remained to be published until 1982, where it was subsequently published. So India has also a good history of IVF pregnancies. So if we see historically also, IVF was first performed for bilateral tubal obstruction. So whenever there is a tubal factor infertility, we have very good results with such kind of patients who have tubal obstruction. Now we have certain kind of patients where anatomically the tubes might appear normal, and the cause is shown as unexplained infertility. However, in such patients who have had previously pelvic inflammatory disease, or can be a functional cause of tubal factor infertility, which cannot be evaluated in ciliary function. So there are certain ciliary movement helps for the union of the sperm and the egg, and also to transport the formed embryo into the uterine cavity. And if suppose the cilia are not functioning well, there is functional problem in the tube. This can also be a cause of infertility, and this can very well be solved by IVF or ICSI. Another set of patients who have problem in their ovaries. So smaller problems in the ovaries can be handled by medicines or intrauterine insemination and a timed intercourse. But if the problems are little bit more, like the age is high, the female is suffering from infertility for more than 6 months, and the age is more than 35 years, we may have to think twice before starting another treatment, and the egg count is already low. These patients can directly go for IVF. There are some set of patients who land up in premature ovarian failure, like the ovaries start dysfunctionally functioning before the age of 35, that is less than 30 years of age. If the egg count is low, we call this as premature ovarian failure, and these are the patients where we may have to go for in those procedures. We can go for IVF, which can important these days is also reduced. We have certain, and in the follicle monitoring scan, we can see the egg rising subsequently to optimum size. But the problem is that this egg doesn't rupture. If we do all kinds of help for the egg to for the egg to rupture, like giving a trigger injection, sorry for the technical glitch in between. So these patients might require IVF directly. There are certain kinds of patients like patients of severe PCOD. So severe PCOD patients fail to ovulate, they have irregular cycles. We can give ovulation induction drugs, but certain times we are not able to control the stimulation. Like there is a all or none phenomenon in PCOD patients. Either they don't form an egg, or if they form an egg, there are number of eggs which are formed, and this condition cannot be managed only by medicines or during the IUI cycle. And therefore, in such patients who have severe PCOD, we may have to go for IVF treatment. There are other group of patients who have endometriosis, like the endometrium inside the uterus has a ectopic presence, like that is present outside the usual site. This is called as endometrioma if it is present in the ovary, and this endometriosis in the ovary can cause a poor quality of oocytes. And if this endometriosis tends to go on increasing as the age increases in the reproductive lifespan, and therefore these are the patients who might require IVF early. So we have seen about male factors, we have seen about female factors. There are certain conditions which are associated with both involving the male as well as female patterns. Certain conditions are called as unexplained infertility, where the egg and the sperm interaction doesn't take place, or if it takes place in the body, that doesn't result in a pregnancy. This group of patients can be classified as unexplained infertility or immune-related disorders. So these kind of patients are ideal candidates for IVF, where we can analyze the egg and sperm interaction, whether it is taking place or not, whether there are any immune factors. If it is taking place, whether it is taking place in a right way, and the resultant embryo is a good quality embryo. All this can be studied only when we are going into a IVF cycle. So this was about the indications. Another important part when we discuss about IVF is the counseling part, which is very important for the patient. At Oasis Fertility, we always follow a transparent procedure while going for a IVF procedure. So all this counseling forms very important part. The patients are uh, like anxious, they are frustrated taking treatment for many years, and sometimes for these patients the last option is IVF. For some patients, as we have seen in the indications, this can be the first option for going for treatment is maybe IVF. But for those patients who have already gone through all this trauma of taking fertility treatment, this can be painful for them, and therefore we at all stages uh, have a counselor who counsels the patients, who tells them what's the treatment like and what's the procedure they are going to undergo. So in this, important thing is indication of the procedure, why we are doing IVF. So we have seen already why we are doing IVF, that is explained to the patients. The steps of the procedure. So we'll be knowing how IVF is done, and is there anything which we should be bothered about? Is IVF going to affect our natural course of living? Is IVF going to affect the natural sexual life? And all these things need to be answered. Pregnancy rate, the success rate is what the patient asks. So counseling should be done regarding this. Number and dates of expected visits. So this is also very important, and the cost of treatment. So all this counseling is dependent upon each individual patient and the couple. So for each and every couple, parts of this treatment will differ, and therefore we at Oasis Fertility follow an individualized protocol for IVF treatment. So regarding the results of treatment, the results can be varied. It can be a cycle which is a very good success rate. There can be fertilization failure at times, as I told you, the sperm and egg when they interact, then only we come to know about the real success. So once fertilization is taking place or not, we'll be able to see only when we are doing the IVF. Sometimes the eggs do not form, and there is may have to go for a cycle cancellation. Sometimes we have other options to improve the success rate. So all these are things which need to be discussed. Sometimes the success will be affected for the reason which we are doing IVF. So sometimes there can be a severe male factor infertility less than 5 million count. There we are doing IVF for azoospermic male. In these patients, the success will depend upon if there are any female factors for infertility, and if there are any problems in the karyotyping, if there are any problems in the DNA of the sperm. All these will affect the fertility. In cases of unexplained infertility, if the age is less than 35, we'll have a very good success with IVF. If there is a failure of IVF, the cause may be in the age, the cause may be in the poor oocyte quality, or the cause may be in the poor sperm quality. Also, the cause may be in the endometrium. So we need to evaluate the patient properly before we go for an IVF cycle. So what are the steps? How we do IVF? So first and foremost thing we talked about is the counseling, which we talked right now. Then we do a pre-IVF analysis of the patient. This is very important to decide the proper stimulation protocol, the proper way to go about it. So second step for doing IVF is the controlled ovarian stimulation. So controlled ovarian stimulation is done for around 10 days after you start your cycle. So we give some injections called as gonadotropin injections. These gonadotropin injections vary. Sometimes they can be urinary injections, sometimes they can be recombinant injections. So these injections are given to increase the number of eggs and so that these eggs reach optimum size. Once you do a controlled ovarian stimulation, you assess the growth of these follicles on sonography. So routine sonography has to be done, and this is very important to monitor the patients and so that they don't land up in any sort of complications. So a well-equipped fertility center will have all these facilities. We do certain hormonal tests at the starting of the cycle and towards the end of the stimulation procedure. So once we are through of around 8 to 10 days of stimulation and the eggs are ready, that means the size is optimum for their removal, then we do a procedure called as oocyte retrieval or ovum pickup. This procedure is usually a procedure which is done under short anesthesia and it is a daycare procedure. The patient should not be afraid of IVF because this will not cause any stitches, not cause any subsequent pain to the patient, and very retrieval procedure is done under short anesthesia, and the patient is discharged on the same day. On the same day, we require the sperm sample from the husband. This sperm sample is taken by masturbation, and if the husband is not able to give sample, we have other options of semen collection. If there is severe oligospermia, less than 1 million count, or there is a case of azoospermia, we may have to go for testicular sperm retrieval techniques. So once this is done and we have sperm available, we have certain things called as sperm selection techniques. And at Oasis IVF, if we have problems with the sperms, like if there is problem in the motility, problem in the count, we have certain advanced things which we follow, like the magnetic assorted cell sorting or MAX technique. We have a technique called as Pixie. We have a technique called as IMSI. All these techniques for sperm selection will help us to select the best quality sperm. And once we are sure that the sperm is best quality, the egg is best quality, the resultant embryo will be of very good quality. And the result of IVF will depend upon how the embryo is and how the endometrium or the uterine lining is. Therefore, we are ensuring at each step that the embryo quality should be good. So this is another step where we do the oocyte retrieval and we retrieve the semen sample. After that, we do what is called as IVF or ICSI. So ICSI is intracytoplasmic sperm injection. Majority of IVF centers who are not equipped with ICSI will go only for IVF, but at advanced fertility centers, ICSI facilities are usually available, and therefore we go for a single egg injection of a single sperm. This ICSI will avoid what is called as fertilization failure, which takes place commonly in IVF. After that, after doing ICSI, we'll observe for the growth of embryos, how much embryos are prepared and what's the quality morphology of these embryos. So that is usually done on day 3 after your embryo formation is initiated. The counseling is done on day 3 and subsequently on day 5 or day 6 where the blastocyst formation takes place. Now what is blastocyst and what are the stages of embryo development? In just few minutes I'll tell you. So once your egg and sperm interacts, it will form a two-cell embryo, and this two-cell embryo will subsequently get converted into 4 cell, 8 cell, 16 cell, and so on. And whenever a cavity forms in that embryo, we call it as blastocyst, and this will take place on the 5th day. So usually the IVF centers which are not equipped for blastocyst culture will grow the embryo only up to the 3rd day, where you transfer a cleavage stage embryo. The results of cleavage stage embryo are not so good as a blastocyst culture. So doing the blastocyst culture, growing the embryo till that stage will enable us to select the best quality embryo, and thus results of IVF and subsequently the live birth rate are also improved by blastocyst culture. So this is done. So this goes under the lab point of view of IVF. The 5th point while doing IVF is transferring this good embryo inside the uterine cavity. This procedure is called as embryo transfer. Embryo transfer can be a fresh embryo transfer, which is done immediately on the 5th or 6th day after the embryo formation is initiated, and this is done whenever the patient is in the same cycle as the IVF is done. So this is called as fresh embryo transfer. Fresh embryo transfer usually has certain problems, like if the patient is receiving gonadotropin injections, there can be a lag between the endometrial cycle and the ovarian cycle, and therefore the implantation success rate might be affected. So now it is said that a natural cycle transfer or a frozen embryo transfer of the embryo results in a very good result. So usually what is done is that we freeze these embryos and then transfer it subsequently in the next cycle, when the anxiety of the patient, the stress due to the giving of hormonal injection in the body is gone, and subsequently a frozen embryo transfer will result in a very good result. Once we transfer, once we are deciding about frozen embryo transfer, we prepare the endometrium for this transfer by giving certain tablets, and this can be estrogen and progesterone tablets. The progesterone tablets are given in after transfer, which we call as luteal phase support. So the luteal phase support or fixing the embryo into the endometrial cavity will ensure that the endometrium grows well, and this forms the last aspect of IVF technology. So in short, this was about the IVF. Regarding prediction of success, so success will be affected by the age of female first and foremost. There can be affection due to the sperm quality, the oocyte quality, and lastly, the success will be also affected by the endometrium quality. Certain other factors needs also to be discussed whenever we are dealing with a case of previous IVF failure. Like there are problems, there may be problems in the uterine environment like the adenomyosis, or there can be problem in the fallopian tubes like the hydrosulfates. So if we are leaving this and then we are transferring, we are not intending for a very good success rate. So we need to deal adenomyosis and hydrosulfates which were missed in previous IVF cycles. So at Oasis, we definitely follow protocol so that we don't leave behind anything and we transfer at an appropriate time. So this is very important. We have options of improving success rate. So how we improve success rates of IVF? So we have certain technologies which is called as blastocyst culture. Then we have laser assisted hatching, where the assisted hatching will improve the success rate in implantation. Then we have certain technique where there is a case of recurrent implantation failure. The embryo was good in whenever after seeing it under the microscope, but it didn't go and implant and didn't result in pregnancy. In those patients, we have an option called as PGTA or pre-implantation genetic testing of the baby, genetic testing of the embryo, because genetically abnormal embryos will not implant, and therefore PGTA, which is showing a euploid or a genetic healthy embryo, which this improves the chances of success in those patients who have recurrent implantation failure and recurrent pregnancy losses. Also, in these patients of RIF and RPL, we need to assess the endometrium and its blood flow. So the optimum endometrium for implantation will be between 8 to 12 mm, a triple line nature of the endometrium, and also the blood flow of the endometrium should be in the zone 2 onwards, that is zone 3 and zone 4 of the endometrium. So the blood flow of the endometrium is also important. So IVF is a very extensive topic and my discussion will go on and on. But these are the ways how we adopt for doing IVF to improve its success. Lastly, I'll only say that IVF has now become a very easy daycare procedure where the patient has to undergo a treatment for around 15 days, and the time to pregnancy is also reduced. So 15 days of treatment, and for transfer around 4 to 5 days in the subsequent month can guide you to a healthy baby and uh, successful IVF cycle in most of the patients where we have a very good planning and where we take into consideration all the factors while we are doing IVF. Thank you so much for your patient hearing. We have certain questions here which have come up, so I'll be taking up all these questions. So one question is from a patient. I'll not reveal her name. So the age is 35 and I 4 IUI and 1 IVF cycle was failed. Her AMH is zero point 0.8. Histolaparoscopy and submucous fibroid later was removed. And in the second IVF, only 5 eggs were retrieved and 1 embryo was formed, which was of B grade. Frozen for 3 months. Later on, transfer after thawing of the B grade was turned into a C grade embryo, and she has no symptoms of pregnancy. That's what after transfer what she tells. So we need to wait for the pregnancy test, which is to be done in your case, madam. So we will hope for the best. In your case, I know that grade B and grade C embryos will give a little bit of success, which is poorer. But we need, before I comment anything about your cycle. However, I will only comment about your AMH and age. So AMH less than 1 and age more than 35 usually affects fertility, but there are certain good techniques which we can use, optimum protocol for ovarian induction which we can use, and in certain cases of failed IVF we have certain different strategies which we can follow, which we will deal subsequently. However, for this patient who has not yet done a pregnancy test after embryo transfer, my best wishes to you. Let's hope for the best. One question is, how many eggs will you try to retrieve? Usually, the number of eggs which is considered optimum and to give a good success rate in IVF is now considered as more than 15. So we should be having that much of antral follicle count in the ovary to get this many number of eggs. These many number of eggs are considered better to have a good fertilization, a good implantation success later on, and also we get a little bit of more embryos so that we can select the best or grade A quality of embryo. So I would answer this as more than 50. What is the different steps for egg aspiration? That is one question. So we just analyze the patients for their pre-anesthetic checkup is done for the patient before they go for oocyte aspiration or ovum pickup surgery. This is a very small procedure which is done under short anesthesia. This procedure usually takes a time of around 15 to 20 minutes in most of the patients, and this is done under ultrasonography guidance. So we have a transvaginal sonography probe which is introduced in the vagina, a very small needle which is placed on this probe which has a guide over it, and we see the ovaries, we see the follicles and remove it under direct visualization. So this is a very simple procedure. Those who are well versed with ovum pickup procedure, this is a very simple procedure for all those fertility consultants. So this procedure will be taking around 15 to half an hour, 15 minutes to half an hour, and you can go home immediately 2 to 3 hours after the procedure. Next question is, how long is the IVF process will take to finish once it starts? So we have, as I told you, once we start, it's around a time of 15 days before we complete the procedure and we are ready with the embryos. The embryos can be transferred inside the mother's, like the to-be mother's uterus immediately, which is called as fresh embryo transfer, or we can do it in the subsequent month. In the subsequent month, we'll be taking around only 4 to 5 days for the mother to prepare for embryo implantation, which is called as the frozen embryo transfer, and therefore 15 days in the first month for preparing the embryo, and later on only 4 to 5 days for the transfer. Once we are done, we check for the pregnancy 15 to 20 days after the transfer. We can do it by a blood test called as serum beta hCG. So next question is IVF safe for mother? So if we consider safety for the mother and safety for the baby, IVF is now a very old procedure. We have around more than 40 years old procedure, and the techniques for doing IVF have continuously been improving. So right now, previously the egg aspiration procedure was done by using a laparoscopy procedure, which required more anesthesia, more time. Right now, we can do it by using a transvaginal probe. So definitely, the safety quotient has improved regarding the operative thing. Regarding giving the injections, the injection quality has also improved. Initially, there were urinary injections. Now we have recombinant injections and highly purified injections, which deliver in a proper way. The dose dependent delivery of results are very good, and therefore the complication rate has gone down tremendously. We have certain other options, like we have the agonist trigger, where we can reduce the chances of ovarian hyperstimulation syndrome. So the safety quotient for the mother has definitely improved. For the baby, if we consider, IVF doesn't cause any serious risk to the developing baby, and it has been shown that as normal it will behave as same as the normal pregnancy will, and therefore there will be no rise in complications during the pregnancy and after the pregnancy to the baby. What is the best age of IVF? I didn't get this question. However, I considered this: what is the best age to do IVF? So usually, uh, there is no best age as such. It can differ for each and every patient, but of course, the success rate by using self eggs will go down after the age of 40, and the fertility will start diminishing after the age of 35. So for pregnancy, if you consider, uh, for pregnancy itself, age less than 35 for natural conception is better. For IVF to be successful, I will consider less than 40 as a better to give better success rate. But those who have a higher age need not panic. We have advanced options of fertility to give to them, and therefore they also can take treatment who are having a more advanced maternal age. Next question is, what is the effect of thyroid on fertility? This is a very vast topic. However, uh, thyroid levels which are less, like we call as a hypothyroidism, where the T3 and T4 levels are less and TSH values are high, this can affect your fertility and also affect the course of pregnancy. Therefore, when we are dealing with fertility, we do a preconception counseling or pre-fertility counseling for these patients, and we correct the thyroid abnormalities before going in for fertility treatment. Next is, are there any lifestyle changes that I should make? Very good question. So, if the weight is more, patient is obese, then there are faulty dietary eating habits. We need a dietary consultation and a consultation for a proper exercise regimen. And at Oasis Fertility, we do this also. And lifestyle, definitely a very healthy lifestyle will matter in your results of fertility and also in your pregnancy outcome. Is there anything which can be done to improve success rate? I talked about it. There are very advanced techniques which we can use to improve success rate of IVF. So I would categorize into the investigations which are done prior to IVF, the procedure of IVF, and any advanced things. So for improving the success, we can do pre-IVF investigations, which will guide us what protocol we need to use, any advanced techniques we need to use, that guide will be to us whenever you are doing a pre-IVF investigation. While doing IVF, when we see the oocyte stimulation, the response of the patient, we'll be able to see the number of eggs retrieved, the number of good quality eggs, that is the M2 eggs which are coming to us, and this will guide us regarding what else we need to do to improve success. So we have options like blastocyst hatching technology. This poor endometrium, where the embryo doesn't go an implant, we have certain advanced techniques. We can use endoscopy, that is hysteroscopy, to improve the endometrium. We have options like multiple medications which can be used. We have options like stem cells, platelet-rich plasma, uh, injection GCSF. All this can be used to improve the endometrium and subsequently to improve success. So success will depend upon multiple factors. We need to analyze these factors and treat each patient as an individual. So there will not be any blanket treatment to every patient. At Oasis, we follow an individualized protocol for each patient to improve the success. I think we are exceeding time. I'll just take 2 or 3 questions more. So, what are my options for embryos that won't be used? So, if you have good quality embryos which is exceeding 2, usually we transfer 2 embryos to give a good optimum success rate. In some patients, we can also do a single embryo transfer. Other patients in whom there are more than 2 good quality embryos, we can freeze those embryos by a technique called as cryopreservation, and these embryos can be used subsequently whenever the couple intends. So all this counseling is done at various levels, and we take a consent for cryopreservation and preserve these embryos for subsequent use. Next question is, where will you use a 3-day or 5-day transfer? As I already said, that blastocyst culture, which is a 5-day embryo, will improve the success rate. I talked about PGD or PGS. So PGD or PGS is nothing but currently the terminology is PGTA and PGTM. So we have talked about that in certain category of patients. We can use this genetic testing before transferring the embryo, which is called as PGS or PGD, also called as PGTA or PGTM. So definitely this will also improve the success rate in some patients. We have one question: how many IVF cycles are safe? A very good question. So usually we are giving a very good optimum success rate, and we try to see that the first cycle is the best cycle for the patient. Once there are certain factors in some patients, sometimes the cycle may not be successful in the first attempt if there are multiple factors of infertility associated in the couple, or the problem is very severe. So in such couples, we may have to go for a second or third cycle. So usually 2 or 3 cycles gives a success rate of more than 90%, 90 to 95%. So that's what I feel. Around 3 to 4 cycles of IVF usually are sufficient for most of the patients. However, saying this, I always reiterate that the first cycle will give the best results. So at Oasis, we try to see that we are successful in the very first attempt. Does women who undergo IVF increase weight? So again, a very good question and a myth associated with IVF. So there are certain myths associated. One of those myths is that the weight is increased. Believe me, we are giving certain hormonal injections during IVF cycle, and this can cause some water retention in the body. So this water retention will lead to only a temporary weight gain. Once you stop using this hormonal injection, the weight which is gained will regain to its normal level, will come down to its normal level. So there is no permanent weight gain which is associated. The slight weight gain can be there whenever we are administering these hormonal injections for 15 days, 10 days, and once we stop using these hormonal injections, the water retention which is there will immediately go off, and the weight will come to normal. Most of the times, some patients there is no weight gain at all. So this is nothing to worry about whenever we are going to IVF cycle. How many IVF cycles are safe? That I answered. Is there a success of IVF in the very first time? Definitely yes. I answered it just now. If we are planning a very good cycle, we are seeing all the factors: male factor, female factor. In the female factors, we are seeing the oocyte factor, the tubal factor, and the endometrium. Also, some problems associated with hormones like prolactin, blood sugar levels, thyroid levels. All these factors, if they are analyzed, taking into account the previous history of the patient, any previous history of abortion, will be able to give a very good success in the first cycle itself. Next question is, how many days rest is required after IVF treatment? So we don't recommend rest at all. So our patients immediately go to their offices after transfer. We don't recommend rest. After putting in the embryo inside the uh, womb or the uterus, the patient can rest for 1 day or two, but she can resume her activities if the activities don't include physical exertion. Like if a person is an athlete, or if uh, he or she is an instructor for somebody, or gym instructor. In these patients, strenuous activities are avoided. In some patients, they can modify their day-to-day activities. Like if somebody is a nursing staff or somebody has a prolonged standing, like teachers, they can modify their activities. They have intermittent time for sitting and taking rest. Definitely can go to job and start their work after doing IVF treatment. No recommendation for prolonged rest after IVF treatment. Is IVF pregnancy like normal pregnancy? Absolutely. So only the formation of pregnancy takes place in a different way. Like normally, naturally, the pregnancy occurs in the fallopian tube. The egg and the sperm meet there, and the embryo is formed. Here, that procedure is done outside, where what we call as in vitro fertilization. So only the process of formation of embryo is different. The egg is good quality, which is absolutely yours. The sperm, which is taken from you, is again if, it is of a good quality. The pregnancy formation takes place outside, and then we are putting that embryo inside the uterine cavity. Therefore, there is no thing such as abnormality after IVF. The baby will behave absolutely as much as normal. Pregnancy takes place. How long IVF process from start to finish? I think I answered that. It's a time of around 14 to 15 days where we complete the total IVF procedure, and we are having the embryos with us. It's up to us when we transfer the embryos. We can start transfer it immediately in a fresh cycle or in a subsequent month in a frozen transfer. Too many questions about IVF. I know it's a topic which is here. Everyone wants to know about it. I think we need to wind up before I take up one or two questions. What is the main difference between ICSI and IVF? So as I told you previously, IVF for ICSI, the embryologist selects the sperms in those patients where the sperms are at problem. There is severe oligospermia, or we are dealing with cases of azoospermia where sperm selection is important. ICSI is definitely useful. In cases of IVF, we put the sperms around the egg, and one of the egg sperm on its own goes inside the egg and fertilizes the egg. But in such cases, there are chances of fertilization failure. If the sperm doesn't have that much energy, or if the sperm is at fault, it may not be able to go inside the egg. One thing, or if sometimes the wall of the egg or the zona is very hard, in that cases also the sperm will not be able to go inside. So in these cases, the IVF might land up into fertilization failure. The fertilization or the embryo formation doesn't take place. To avoid this, we have advanced technique called as ICSI, where we place the sperm directly into the egg cytoplasm, and this gives a very good embryo. How much is the pain for IVF? Absolutely, the injections what we are using are painless injections, and during the ovum pickup procedure that is done under anesthesia, so most of the patients experience very less or no pain. In certain kind of patients, there might be little pain, but that pain is temporary, restricted to the flag end of stimulation, like the towards the end of stimulation, there can be some heaviness which is felt. Absolutely, no severe pain is felt in such cases. What are some side effects of hormonal treatments or trigger injections? That is one question coming up. So typically, no severe side effects as we discussed. There can be two or three side effects or certain things which need to be discussed with the couples prior. So one is during stimulation, the ovaries can stimulate little bit, can get stimulated little bit more, which we call as ovarian hyperstimulation, which we call it as OHSS. So OHSS may sometimes occur if we take a very good stimulation protocol, if we follow a very good trigger protocol, then OHSS usually doesn't occur. At Oasis, we are OHSS free clinic. We don't usually have any case of OHSS we have not seen in many years. So if we follow a good stimulation and a trigger protocol, we don't land up in ovarian hyperstimulation. Second complication or side effect of IVF, you can say, is multiple pregnancies. So sometimes there can be two or three pregnancies. At Oasis, we usually don't put more than two embryos inside. That's the higher end which we put. The number of embryos is restricted to two. Or if the couples are sure that they want a single embryo transfer, that policy can also be adopted. So this is about the probable side effects of IVF. So I thank you all for a patient 45 minutes hearing of this IVF session. I hope I have answered all your doubts. Whatever doubts I was not able to answer, you can just put it in the Facebook live session, or the number is shown there. This is our 24 hours number. You can call us anytime for any kind of help in fertility. Uh, Last question I would take is: are there any long-term side effects of infections by in IVF treatment? So probably no sort of infections are associated. We don't anticipate. We are taking proper care, proper antisepsis while we are performing this procedure. Also, in these times of COVID, I would like to say that we are using a very strict protocol. We are following a standard operating protocol for COVID-19 to prevent COVID-19 infections to our staff as well as our patients. So we are restricting our appointments. We are following social distancing. We are using hand washing and hand hygiene techniques, and also we are providing masks and other things for respiratory hygiene to the patients. So be assured that at Oasis we are taking utmost care to prevent any sort of infections to IVF patients. Thank you so much. Thank you for your patient hearing.